Hi, my name's Jason. I'm a paramedic nurse, and I deal with some of the most infectious patients in the medical system. And I think my job gives me some unique perspective about the coronavirus. And I'd like to share that with you because I went to Costco today, and I don't think the United States has a plan or that Americans are ready to deal with the coronavirus based on what I'm seeing. So I'd like to present a few ideas to you over the next 30 minutes or so. I'd like you to think about them because there are a couple of considerations that nobody is talking about. And those three considerations are, if the virus is coming, how do we prepare for it as a nation, what we are expected to do while the virus is peaking, and what happens when we come out the other end. Because let's be real, Americans don't do quarantine well. We tried to put people in New Orleans in the stadium, and you can't put that many people with that few toilets. They tore it up. Quarantine doesn't work well here in America. Self-quarantine doesn't work well. Remember the Ebola virus? Okay. There's only two ways that the coronavirus is not coming to the United States. One, summer comes, and the virus just doesn't have the same infection power in the heat that it does at the moment. Two, any random thing. That's the only thing that's going to keep the coronavirus from coming to the United States. You've been watching the Johns Hopkins map, right? You've seen the spread in Wuhan, how it started in the middle with a couple of red dots. As the middle got bigger, the red dots got bigger and they got further out. Then the red dots started overlapping as the infection started growing, right? Remember those overlapping red dots on the Johns Hopkins. Now we're seeing it in the United States. We're seeing it down the West Coast. We're seeing it up in the East. It's starting in Texas. It's up in Ontario. And so our borders all the way around on the way in, we're starting to see those infections. It's very important that we all understand the timeline of the coronavirus infection because I've seen bits and pieces of it here in the news, but nobody has put the whole thing together in terms of severity. And I don't think, again, that the United States is ready for this because the stock market's only crashed a little bit in the last couple of days. And yet we've been watching the situation evolve in China for more than 90 now. Their people have been quarantined coming up on 2 months. It's not going to happen in America, not just because we're Americans, but because here in the United States, nobody has those kinds of food reserves. There are very few people with those kinds of food reserves. And remember, we are 9 meals away from anarchy. Think about what you would do as an American who has had food your whole life and has never seen a shelf bare do without food. That's why you don't have more than 10 days of food in your house. Because you can always just go get more. Americans are not prepared for that kind of mentality quarantine situation. Even the ones that are prepared are not prepared for the length of time. I went to Costco today and everybody had 2 cases of water. I was talking to the Costco guys there. Everybody was buying 2 cases of water. I would like to do a quick review of the timeline. In case the coronavirus does come to America, I would like to point out what is required to quarantine the coronavirus now that we have some scientific information. Ready? They say the coronavirus will live on surfaces, a fomite. The coronavirus will live as a fomite for up to 30 days. Let's just say 30 days. Even if it's a little less, let's just say 30 days. 30 days. And you can then be a carrier without symptoms for up to 30 days. Now, if you get infected, there's one of 2 paths that there seems to take, right? Most people get a gentle case of the flu-like symptoms, and then there's a small percentage that in 7 to 9 days get pneumonia. Of the people that get pneumonia, if you get medical care, most of those will survive and a few will fail. So most of the people fall out, they get minor cases. If you get pneumonia, You've seen it. Now, if you get pneumonia and you have to be hospitalized, you will be hospitalized for about 2.5 weeks. That means that it's 9 days plus 2.5 weeks. That's a month, whether you're sick and you go to the hospital, or 2.5 weeks if you don't go to the hospital, 3 weeks if you don't go to the hospital. Either way, you're a month if you get sick. It's 1 month live on a fomite, 1 month harbors in a person, right, without showing signs and symptoms, and 1 month infection. And all of those are based on the last data that they're telling us. That's if you can get infected twice. They're telling us somebody got infected, reinfected. And that's if the strain doesn't mutate. You have to consider that the strain could mutate, become far more virulent, and travel right around the world again. Because anybody who got immunity to the first one did not get immunity to the new, more virulent strain necessarily. So there's a couple places that things could fall out. Summer could postpone the virus till next year. But in America, without the ability to quarantine for 90 days, and at the end of 90 days, you could do another 30 before you were sure nobody was going to get it again. And even then, you would still have to be vigilant, right? So it's a minimum of 3 months. 3 months. For Americans, that's like 4 months. I mean, it's such a huge amount of time. We've never... Now, let's say the strain doesn't get virulent. Let's say things just continue, everybody gets better, just like we saw in China, because now the numbers are falling. That is no guarantee that there's not going to be flare-ups, it's not going to move to a new city, it's not going to mutate. There's no guarantee that any of those things aren't going to happen, and it wipes through the whole thing again. And one of the big factors to consider is that in the 90-day time frame in China is that they were clustered with far more people in more vertical, smaller areas where there are more people together. In the United States, we're very spread out. If spread out slows the rate of infection, then 3 months could very easily become 4 months as the virus spreads across America. Okay? That's the timeline, is 4 to 6 months if summer doesn't push this out. It's end of February, March, April, May, June, July, August, that what was 90 days in a very vertical city with people close together might be much longer, 4 or 5 months in the United States, plus an extra month. The time frame for 2 cases of water at Costco does not match the reality of the situation. More importantly, I have 90 days worth of food. I just gave you a scenario that was 6 months, because we're at 2 months in China and they're still not back to work. So we already know 2 months. End of December, February, March, January, February, when the doctor first broke it that died back in December. I mean, they've been quarantined for 2 months. It may have been going on for 4 months over there. If it's going on for 4 months over there, we're at 6 months minimum in the United States of how do you shop now. I'm going to tell you something you don't know because I deal with the sickest patients in the medical system. Okay. I do the world. I'm a PIC nurse, and what that means is I do the world's smallest surgery. I put an IV line in your arm here that goes up to your shoulder or into your chest so they can deliver the most aggressive medications to the sickest people, because you can't put those kinds of medicines in the small veins of your hands and arms. Now, I don't go to the athletic club and do this procedure to healthy people. I only do it to the sickest people that need the strongest medicines. And I go from facility to facility and I see everybody and all the nurses, and they're all working super hard, and the CNAs and the LPNs, and not once in the year that I've been doing this have I ever seen a dirty patient that made me think, whew, I wish somebody would change him. This is no longer 1974 medicine. The nurses and LPNs and CNAs are fantastic, and we see that every time there's a problem. However, they're not all trained to deal with infections in the same way. And what I do as a PIC nurse is I'll go out and put this IV in you because you have an infection and need medicine. And then a week later, I'll go to room 102, and then in a week 104, and then in a week, sometimes it's the other way. You know what I mean? It'll be 105, 103, 101. It just depends on which way the CNA or a careless professional is taking the problem with them, and it moves down the hall. I've been doing my job for about a year now, and it takes a while and a bunch of times to get good at putting on the protective gear. It is not something the average citizen is going to be capable of doing in any reasonable time frame. So if the coronavirus comes to the United States, you will get it. You don't think about the things you touch and your face. You don't consider any of those things. I've had to break many bad habits touching stuff, like my eye just now, at my job, okay? You are going to get the virus. We know the symptoms and time frame of the virus now too, right? Because what we've learned is that 6-month quarantine. We have 3 problems coming in the United States. As it starts, at the peak, and as it finishes. And what we have to know about those 3 things is this. We've looked at it develop in China. We know how it's going to spread here in the United States. Is the United States prepared? Is the United States willing to start turning things off? We have a couple of weeks' notice as it starts to build. Government agencies should start parking their cars. People should start bringing supplies home as they can afford it on a very quick basis for 6 months. 4 months worth of supplies, 6 months worth of supplies. We should start preparing to turn things off. I have no idea how we handle nuclear reactors, but we should start preparing to turn things off. Because in China, they just turned things off and everybody went home. They'll just all go back to work. There won't be any rioting. They don't have to rebuild Martin Luther King Street in every city in the United States when there are riots and people, right? The people that have the least amount of food stores, the highest percentage of food stamps, they're going to be the first people who hit 9 meals with no food. And let's be realistic. It's a pattern in America. And if we want to protect our people, we don't have to call them out on it, but we do have to prepare for it, because once they burn down their own city, what's next? You're going to start shooting people from other cities? You're going to go to Los Angeles and the homeless population? Because the problem with the coronavirus, and what none of you know, is this. The United States healthcare system is at 100% peak capacity every day. Hospitals are hotels that are in the business of making money, and they don't break even until 92%. And you can only get about 97% full because people have to come out and go in. We are at 100% capacity in our medical system. I am a paramedic nurse. When I tell you that we are at 100% capacity, I would take people from my ambulance. We would get diverted from hospitals on a Tuesday evening. I have been to the hospital when there are patients on the floor. It does not go over well in America because we're all so demanding. Fine, no judgment. I don't care. I'm demanding too. I get it. But it doesn't work when everybody in China brings their own chair and sits quietly until they get better or die. You saw what they did with the hospitals. You can't do that in the United States. And if you can, now is the time before it's sick. They did it in 10 days when everybody was sick. That's not the United States. There's nobody protesting. So, here in the United States, if the ramp-up time like we saw in China was 4 months, from when they didn't tell us to when it really started peaking on that Johns Hopkins map, then right now we're coming up on the end of month 1 because we've seen those couple dots in the United States for 30 days. That means we've got 3 months before this is peaking. It's simple. We all know it's coming. Start sending people home, because the problem is EMS won't be able to come to the rescue. Think about this. I go to all these facilities, okay? I go to all these facilities. We saw what happened to the nurses in Wuhan. They got sick, they shaved their heads, whatever. Whatever. The problem is this. If we are at 100% capacity at the facilities, and I probably go to 20 facilities that probably have 150 patients in them, okay? So 3,000 patients. I'm going to tell you something about the United States. As generous as the United States is, as well-meaning as the United States is, there is no other country that keeps dead people alive as long as we do. I go see so many people that are contracted, locked up, have no mind. I'm performing medical procedures on them. Consider this 4-month problem. Consider how everybody went to the hospital in Wuhan, laid in a bed, sat in a chair, and either waited to get better or died. They got up, they did yoga, they were exercising together. We can't do that on a good day in America, which is fine, again, fine. But nobody was shooting at each other in China. And if we don't address the problems in advance now, because 20% maintenance relieves 80% repair, if we don't address the issues now in advance, then it's going to be Chicago everywhere. How could it be otherwise? Everybody has a gun. I've got them. Yeah. Do you see my point? If we don't address the problem, and 9 meals from now it descends on burn your city down and then start hunting in other cities, it's immediately going to be a problem. And this is the third thing. How do we want to come out the other end? Because if we burn our city down, when it comes time to turn the lights on, and if we shoot everybody and it comes time to turn the lights on, and we've been starving and it comes time to turn the lights on, and we don't have anybody that knows how to turn the lights on, what's the United States going to do? Soon as you turn stuff off, it costs 10 times much to get it started back up again. Just ask any one of the car manufacturers who had to close a plant. Ask Boeing, who has to go back and re-inspect all of their planes before they go back into service when they're ready, or restart the facility to make them. It costs 10 times more to fix something than it does to deal with it up front. And we're America. Let's deal with this right now. We have 60 to 90 days. Shit, they did it in 12? Let's do it in 12. Let's just do it though. That's the problem, isn't it? It really doesn't matter what party you're with. They're still talking about whatever the government's talking about, and there's no warning from anybody. And I've been telling everybody for months what the cycle is. If it takes 6 months, how do we solve the food problem? How do we solve the crisis of what happens while people are getting sick? Because if we can't offer medical care to the percentage that gets pneumonia or worse, then all of the people that get pneumonia are going to die. Now that I've said that, let's take a look back to my comment about the facilities and hospitals are at 100%. The facilities that I go to are at 100% capacity. They struggle when a nurse calls off or they're missing a couple of CNAs. They fall behind. I see the stress. It's a very difficult job on a good day. It's a very emotional job on a good day. And then you add the stress. Now, you've got 3 wings. You've got 30 patients on each wing. That's 90 patients. You've got 4 nurses, 1 down each wing, 1 coordinating them. You've got 5 CNAs, and because one of the wings is a vent tube, you've got 2 respiratory therapists. 5 CNAs, 4 nurses, 2 respiratory, that's 11 people. If you lose 2 CNAs and a nurse, so you have 4 nurses and 3 CNAs and 1 respiratory, it's not possible to run the business at the facility as an ongoing concern. If what happens is, Because here in the United States, we keep dead people alive because we offer care, because our elderly are put away and kept alive forever, where in most other countries they live with their families until they die. Because we put them in these facilities. If you have 3 nurses, 1 CNA, and 1 respiratory therapist, you cannot, America, it is not fair for you to expect the rest of the medical professionals to go to work because they will not be able to give appropriate care. Forget the rules. There comes a point when there's not enough nurses to do the job. When there's just, what are they going to do? Sit in their own poop and pee? Because they're giving them medicine? Nurses are worked at 110%. Facilities are all at 97% capacity. It is a dangerous equation. And here is the sum. When the coronavirus gets moving and the infection rates start climbing, like we saw in China, and the red circles start getting bigger, as that starts happening, if you can't walk out of a facility under your own power, you will be dead within a week. If you require 24-hour care, you will be dead in 72 hours. There will be nobody cooking food. There will be nobody to serve, clean up the patients, issue medicines, move the med cart. Or will people break into the facilities and steal all the meds? Absolutely. Why? Because if you're not rioting in poor, underserved communities, you're going to be in the rich communities and addicted to whatever it is you're addicted to. I don't care. How are you going to do that? How are you going to solve your addiction? So what's going to happen? The rioting is going to meet the addicts downtown? How are you going to stop a quarter of the homeless population in California from coming into your house? If you live in an apartment complex and it's 9 meals since someone has 8, do you think they're going to, as a group, come into your apartment complex and take your food? Absolutely. America. That was how it started. You will not be able to call 911 because I will be home. You will not get any EMS services, and once the rioting starts, there's no way to put out the fire. The scene will not be safe for fire to enter. There won't be any metro anyway. There won't be any fire anyway. And this is one of those situations that if the United States is not careful right now, we can't come out the other side. Don't you all understand that? If we don't protect our assets right now, as we have to turn things off, how are we going to turn them back on? How are we going to turn the lights back on if we burnt everything to the ground? And when I go to Costco and I see 2 cases of water, I don't think, when I see only in the last 72 hours has the stock market crashed, as people have started to realize, this problem won't be over until we don't have enough truckers to bring back the massive restocking supplies from China and everywhere else. When there's so much stuff on the docks of the United States that we don't have enough people to resupply our shelves. Because if I'm right, and it goes down, I couldn't imagine any other way, what's going to happen in the breakdown process? How do you get, if I've got 40 facilities worth of people, worth of businesses, which facility do the people, if you need a couple facilities, do you send the nurses back to where they were working? Or do you have to consolidate the effort? Does the United States shrink, come in from the edges, and we consolidate around Colorado? What happens if we do burn it to the ground? How do we turn it back on? What happens at our shores? Do we have enough military to protect us? What happens to the nuclear power plants if nobody goes to work? There is no quarantining unless there's no, you know what I mean? Unless you can turn everything off, and you can't. All we can hope to do is spread the virus over the longest period of time, provided summer doesn't kill it, so we can help as many people. But the longer you spread it out, the longer you have to feed everybody else. Are we up for that challenge? Otherwise, let's get this over with, hit everybody at once, and let's go from there. That makes sense too. You wipe them out. Because how do you clear the bodies out of the facilities if they're dead? How do you know how to do that? Do we wait till it happens in China? We watch what they do? Oh wait, no, they don't have that problem. Do we look at the other countries who are not reporting? The problem is we have a window to act, and our government is paralyzed on every side from every direction. Nobody understands the time course on this, and because of that, we are going to have problems in the United States that we could have completely avoided if we just looked at it right now, what was happening, and how we could avoid the obstacles. I made this video on green screen so I can add to it later, right or wrong, so you can add whatever you think in the background on this. My name is Jason. I'm a paramedic nurse. I wish you all the best of luck in these times. They're very exciting. Personally, I'm hoping for the zombie apocalypse. I'd rather get 5 more zombie apocalypse years than end up in one of the facilities where I go and treat people. That's very scary to me. A lot more scary than the zombie apocalypse. But think about what I've said, because we have time to solve the problem if we act right now.